During this video, we will review Delta Dental of Oregon's Health Through Oral Wellness program and show you how you may help your patients qualify for extra benefits. At Delta Dental, we believe in an evidence-based approach to dentistry, placing an emphasis on preventative care. Health Through Oral Wellness focuses on early intervention to patients at risk for caries, periodontal disease, and oral cancer. It utilizes a clinical risk assessment tool to provide enhanced benefits for at-risk patients at the point of care. Delta Dental has partnered with a third party called Provisor to offer this risk assessment tool to you at no cost. Provisor is based on Canberra, American Dental Association, and the American Academy of Pediatric Dentistry risk factors. The following employer groups are currently eligible for the Health Through Oral Wellness program: HtOW, PEB, Adidas, Moda Inc. employees, not to be confused with Moda Health Insurance members, and ODS Community Dental. Over 1,300 groups have joined since launching the program, which includes nearly 600,000 members in eligible plans and growing. For a patient to qualify for enhanced benefits, they must have their provider perform a clinical risk assessment via Provisor. If they receive a risk score of 3 or higher on a 1 through 5 scale, they may qualify for enhanced benefits such as extra cleanings, fluoride, sealants, and tobacco cessation counseling. Providers may perform a clinical risk assessment on any of their patients. However, only Delta Dental members who have the program may be eligible for enhanced benefits. This slide demonstrates the risk scores needed to receive the enhanced benefits. The patient only needs one of the following risk scores to receive the caries and perio benefits listed on the right-hand side. In other words, the patient must receive a caries risk score of 3 or higher, a perio disease risk score of 3 or higher, or a perio disease severity score of 4 or higher to receive the following benefits: a prophy or perio maintenance once every 3 months, fluoride once every 3 months, sealants once every 3 years, oral hygiene or nutritional counseling once every 12 months, and drugs or medicaments dispensed in the office for home use once every 6 months. Age limitations for fluoride will be waived if the patient qualifies for enhanced benefits. This means your adult patients may qualify too. Drugs and medicaments include, but are not limited to, chlorhexidine, Paradex, prescription strength fluoride products, MI paste, xylitol, and Lolos. They do not include prescriptions that require the patient to go to the pharmacy. D9630 is a Class 2 benefit, which means that if the patient has a deductible they haven't met, it will be applied. For a patient to receive the tobacco cessation counseling benefit, they must receive an oral cancer risk score of 3 or higher. Enhanced benefits for ODS Community Dental Medicaid vary slightly. Sealants are covered once every 2 years, and tobacco cessation counseling is already a planned benefit. We still recommend assessing your ODS patients for oral cancer. Assessment codes are covered once every 12 months for both ODS and Delta Dental members. D0601 should be used for low risk, D0602 for moderate risk, and D0603 for high risk. For Premier and PPO members, reimbursement depends on your contracted fees. For ODS members, reimbursement will be $11. Once the assessment has been completed and you have received your patient's risk scores, you'll be able to immediately verify if your patient has qualified for the enhanced benefits by checking Benefit Tracker. Under the Group Limitations link, it will note if your patient is eligible for the program. Once they've qualified for enhanced benefits, it will add a description at the top that will either say the patient has Health Through Oral Wellness, caries/periodontitis, and oral cancer, which means they qualify for all of the enhanced benefits. Health Through Oral Wellness, caries/periodontitis only, which means they qualify for all the enhanced benefits except tobacco cessation counseling. Or Health Through Oral Wellness, tobacco cessation only. The next few slides will demonstrate how to complete a risk assessment in Provisor. When you register for a Provisor account, you will create your own username and password. Only one Provisor account is needed per office location. Be sure to select a username and password that all users within your practice may utilize. You will also be prompted to create a 5-digit PIN number for your practice. Once registered, we recommend creating separate PIN numbers for each user within your office. The Browse Patients tab on the left-hand side is the landing page once you've logged in. Patients need to be entered into Provisor before a risk assessment can be completed. Once you have been using the tool for a while, you will have entered patients into Provisor. You can type a name into the search bar to browse patients, or scroll down the patient list alphabetically. To enter a patient, click Create New Patient. You may conduct clinical risk assessments on all of your patients. For Delta Dental patients, be sure to select the patient's insurance company from the drop-down. The insurance company selections will be sorted in alphabetical order by state. Scroll down to Oregon - Delta Dental of Oregon. Once you've selected the insurance company, you will be prompted to enter the subscriber ID number, group ID, and will need to indicate if the patient is a subscriber, spouse, or dependent. The other required fields are first name, last name, gender, and date of birth. We encourage you to ask your patients if they would like to receive oral wellness messages from Delta Dental. These help explain what their risk levels indicate and provide steps they can take to improve their oral health while encouraging compliance with your recommended treatment plan. To opt in, check the box under Patient Engagement and enter their email address, only if the patient is in front of you and gives their consent. Once you are done, click Save. You will either receive a message that you successfully created the patient, that an error occurred and to contact customer service, or that no insurance was selected. If conducting an assessment on a Delta Dental of Oregon member, be sure to go back and enter their insurance information so that their benefits will update if they qualify. Once you have successfully created the patient and you are on the patient details page, you will see 4 different assessment options. You can complete an individual assessment for caries, periodontal disease, or oral cancer, or you may complete a comprehensive assessment that provides scores for all 3 risk categories. We recommend completing the comprehensive risk assessment unless it's a child or someone not receiving periodontal probing. This slide shows a sample of some of the questions that are included in the comprehensive assessment. Most questions have a default answer, which is typically the most common or healthiest option. The assessment may take a few minutes to complete. You have the option to save for later. This is a good option if you want to preload information before the patient is in the chair. It's important that the assessments are completed while the patient is in the chair so you can discuss their risk report with them and so they may qualify for enhanced benefits on the date of their appointment. To retrieve an unfinished assessment, click Unfinished Assessments on the left-hand side and select which assessment you want to resume. To submit an assessment, click Finish. As your office grows and your list increases, a more efficient way to locate individual patients is to select the Browse Patients option, then search for the patient and resume from that screen. After you click Finish, the risk scores will automatically appear in an oral health report like this one. These can be saved and printed for the patient. They are available in both English and Spanish. The arrows on this slide indicate which scores may qualify your patient for enhanced benefits. These patients need to receive one of the following to qualify for the caries and perio enhanced benefits. Tooth decay risk score of 3 to 5, which indicates moderate to high risk for caries. Gum disease risk score of 3 to 5, which indicates moderate to high risk for periodontal disease. Or a gum disease score of 4 to 100. The gum disease scores measures the severity of the patient's periodontal disease. 4 to 10 is mild, 11 to 36 is moderate, and 37 to 100 is severe. For a patient to qualify for tobacco cessation counseling, they must receive an oral cancer risk score of 3 to 5. To reassess a patient, select the patient under Start New Assessment. Then select the same type of assessment that was previously submitted. You will then see the option to load last assessment values. If not much has changed since our last assessment, this may be a better option than starting a new assessment. Once you have answered the assessment questions, click Finish to receive the oral health report and for the patient's benefits to automatically update. For patients that had previously qualified for enhanced caries or perio benefits, this will extend their enhanced benefits for 14 more months as long as they remain eligible for the program through their plan, even if their oral health has improved and their caries and perio scores do not indicate they are high risk anymore. To register for a free Provisor account, visit deltadental.or.com/oralwellness/providers. Click on Register Now in the upper right-hand corner. You will be redirected to the Provisor registration page. Complete the requested fields and click Register. You will receive an email from Provisor to activate your account. Please keep your username, password, and encryption key in a safe place. As a time-saving tip, we suggest you add this link as a shortcut in your browser so you only need your 5-digit PIN upon login. We recommend using Chrome or Firefox as your default browser. By registering for a Provisor account, we will add a badge next to your name and to your clinic and Find Care. This lets patients know that you are registered for the Health Through Oral Wellness program. Have questions? For help with the tool, please contact Provisor Support. For questions regarding member eligibility or claims, please contact Customer Service. For further information regarding the Health Through Oral Wellness program, or to request a one-on-one training with your office, please contact Professional Relations at 844-663-4433. In summary, registering for this program and completing Provisor risk assessments will result in the following benefits. It will create a patient-centric clinical experience that builds patient satisfaction and loyalty. It will enhance your practice and qualify eligible patients for extra benefits and related care. It will improve patient acceptance of your dental treatment, patient oral health, and your bottom line. Thank you for participating in the Health Through Oral Wellness webinar. We look forward to helping you optimize the health of your patients.